Hello and welcome. The figures released by the NCDC shows that there has been a steady rise in the number of confirmed cases of COVID-19, and as such, we should continue to adhere to measures already stipulated by the federal government to curtail the spread. These measures include the use of face masks, proper hand washing, and adherence to social distancing. The use of face masks is particularly important if we have to leave our houses to areas where it is difficult to observe social distancing, for example, the market. This is Inside Health. The use of face mask not only protects one from the other person or protects the other person from us, it also protects us from ourselves. Because when you have your face mask on, you have less access to your nose and your mouth, and you are unlikely to touch them involuntarily with contaminated hands. So when you come back from the market or anywhere you've gone to, you take off your face mask. If it's to be reused, you wash it with soap and water and hang it under the sun to dry. The sun emits ultraviolet rays, and this can effectively destroy the coronavirus. COVID-19 is not a respecter of personality, of gender, of ethnicity, or socioeconomic class. But there are a particular group of people that are at a higher risk of developing more severe symptoms if affected by COVID-19. These include the elderly. By this, I mean persons who are 65 years of age and older. Also, persons suffering from other health conditions like diabetes, hypertension, asthma, or those who use steroids are also susceptible to having a more serious infection, or they can have a prolonged recovery period, or can even die from this disease condition. Our discourse today is going to be centered on diabetes mellitus.
Safe Cube Antibacterial Hygiene Kit.
Diabetes mellitus, or simply diabetes, or DM, is a situation where there is a dysregulation of the blood sugar control. Normally, when we eat carbohydrates, it gets digested and is absorbed into the blood in form of simple sugars, especially glucose. And when the amount needed to be used by the body has been utilized, the rest is converted to glycogen and stored in the muscle or the liver to be used subsequently if the need arises. But in patients with diabetes, they are unable to carry out this function. So how does one get diabetes? It's either you are born with it, as in the type 1 diabetes. In this case, the sufferer is dependent on insulin to survive. The other type is acquired. This is the type that is common among adults. Risk factors for the second type of diabetes are 1. A family history of diabetes, especially among first-degree relatives. By this I mean one's father, one's mother, or one's siblings. Other risk factors include obesity, smoking, alcohol abuse, or use of steroids. So how does diabetes manifest? If you have diabetes, you might discover that you keep having boils. You have one boil, for example, in your armpit, you treat it, it disappears, another one comes up. This could be a pointer to diabetes mellitus. You can also notice that you are passing urine frequently, large amount of urine, with corresponding increased intake of water, because you are always thirsty, so you keep drinking water. Also, you notice that you have increased appetite with no corresponding weight gain. Diabetes affects the body's ability to fight infection. This it does by affecting the function of the white blood cells. These are the cells that enable us fight infections. These cells become lazy and are unable to discharge their function properly. So it is no wonder that persons with poorly controlled diabetes might come up with a more severe infection or can even die if affected by conditions like COVID-19. Among other acute complications of diabetes is coma. The patient can just go unconscious, and this can be the first manifestation of diabetes. And coma requires high dependency care. Some of these patients might die, some might recover with no sequelae, or some will recover and have complications of prolonged unconsciousness. In order for us to completely understand the chronic complications of diabetes, we can look at it from a common sense perspective. The patient's blood is usually saturated or has high levels of glucose persistently. And this blood flows to every organ, every part of the body. And as such, these organs receive blood that is always high in glucose concentration. And this glucose begins to react with different structures in the body. Diabetes causes the lumen or the caliber of these arteries to reduce. For example, your artery has this diameter. Diabetes makes it to get narrow. So virtually every organ of the body would receive reduced amount of blood. And over a period of time, this begins to affect the function of these organs. Diabetes also affects the nerves. And we know the nerves is what carries sensation. So if you have uncontrolled diabetes, over time, the sufferer begins to have reduced feelings, first in the hands and then in the feet. Diabetes causes stroke, and stroke is a result of an interruption of the blood supply to the brain. So a narrowed vessel that has been caused by diabetes can become blocked completely by an acute event, and that is stroke. In the heart, the same thing happens and the patient develops a heart attack. Diabetes also causes chronic kidney disease and can link to end-stage kidney disease, where the patient might require repeated dialysis or even a kidney transplant to remain alive. This same process occurs in the eyes and can lead to diminished vision and even blindness. We cannot conclude our discussion on diabetes mellitus without talking about diabetic foot syndrome. And to understand this, we can work it out from basic principles. We have established that diabetes affects the nerves, so you have reduced sensation in your foot. And as such, you can injure your foot like stepping on a sharp object and you wouldn't know, because there's reduced pain. Also, there's reduced blood flow to the foot, as already established. So nutrients and oxygen doesn't get to the foot in adequate quantity, so healing is slow. Also, the white blood cells that ought to fight the infection are abnormal, as already established. So you find a wound that festers and continues to progress. So diabetes is the commonest reason why we amputate people's legs, and this is the same in most other clients. So as this continues, the foot begins to die, starting from the toes, and it continues and progresses upwards. So when you come late with these conditions, we offer you amputation depending on the appropriate level after evaluation. This is Inside Health. Don't forget, COVID-19 is still with us. Continue to adhere to the measures, practice social distancing, wear your face mask, wash your hands, clean and disinfect frequently touched surfaces. Stay safe. This is Inside Health. I'll see you next time.